And we're going to engage in something called the River of Life. Now, the River of Life is really a reflective exercise that can happen along two ways. We know that many of you in the room come here as individuals. You might be students, you might be researchers, you might be service providers, or even social activists. So one way to approach this is through how you engage in CBPR as an individual. We also know that we have some CBPR partnerships in the room. So another way to approach this activity is to collectively reflect on your partnering practices. So what I'm going to give you in the next few minutes is a bit of instructions, both for how you would do this as an individual and how you might apply this as a community. So the way this sort of exercise works is it's a reflective exercise, and we like to think of the river as a journey metaphor. You might use other ways of doing this, but it's really worked for partners in the past to think about the ebbs and flows of what got you to where you are today as a CBPR practitioner and as a partnership. So if you're doing this exercise as an individual, you have an overarching question that you're going to be thinking about. In simple terms, what brought you here today? What contributed to your interest in community-based participatory research? If you're thinking about this through your individual lens, it's important to think about the values and influences that brought you here. For some of this might be our family. For others, it might be our cultural identity, or a variety of other identities that we participate in that brought us to this place to want to engage in this sort of action research. You can also create a river of life when you're thinking about your CBPR partnership. When you're using the river in this way, you're using this as a collective reflective experience for your partnership to think about some core issues. To start, it's important for you to think about what is the overarching history and influence that has motivated you and your partners to come together, right? What brings you here to think about promoting community empowerment, social participation, and health equity? What is the history of your partnership? How did you get started, and what is keeping it going? So when you start your drawing, you have colors, markers, butcher paper on your table, and you can be as creative as you'd like. You want to start with your beginnings. So if you're thinking about this in the context of your CBPR partnership, what are the headwaters or springs? What are the values and resources that started your partnership? Or what are the key previous historical events that ground what you're doing? What is it important for others to know about your community context and how that community context has influenced how you partner together? As you follow your journey, similar to an individual river of life, you're going to think about the key events that have framed your partnership. You're going to think about your barriers to success. You're also going to imagine your facilitators as well. And again, what are the important tributaries? What are the mentors or other influences, whether it's funding, key partnerships, key organizational changes, that have moved in and out of this journey that have framed how you work together? Now, for some partnerships, we have found that it's been really useful for them to draw a historical timeline under their river. This serves as a way to kind of mark key external events that have influenced your partnering practices, okay? When you're done with the activity, the idea is to collectively share it with others, and you can use it back with your own CBPR teams to continue to kind of work on your own collective reflection as you move forward in your project, okay? So to conclude, I'm just going to give you a few examples of rivers. So here you'll see this is one from a Utah partnership working on child welfare and health collaboration. And of course, we don't expect you to come up with this kind of visual graphic. This is something they worked on a lot over time, but this just gives you an example. And here's another example from a Minnesota partnership working on leadership, where they sat down and at the table kind of collectively drew this together. Okay? All right.
In 2014, we got a CDC REACH grant, that stands for the Racial and Ethnic Approaches to Community Health. And that really let this flood of boats, we really started to partner with a lot of grassroots partnerships.